Hello, everybody. If everyone could come back in and get seated, we're going to move on with the program. First, thank you all for being here. Seeing everyone come together today here in Washington, D.C. and around the country is inspiring, and we look forward to seeing the progress that emerges. As the Vice President has made clear, progress in this fight against cancer is going to take each one of us doing our part, from the researchers, oncologists, philanthropists, patient advocates, survivors, and patients themselves here in this room, and engaged citizens around the country. We can all play a part. Please share your experiences throughout the day on social media and tell us what more you are willing to do using the hashtag #CanServe. And for those of you here at Howard University, visit the interactive space on the other end of this floor to contribute to the White House social media coverage of today. I just wanted to take a quick minute to outline for those of you here how today is going to run. Our goal is to stimulate bold new ideas, new partnerships, new collaborations to double the pace of progress toward ending cancer as we know it. In the plenary sessions, we will hear from individuals representing a few examples of the more than 35 new actions announced as part of the summit today. But this is just the start. In your breakout sessions, you will be identifying barriers to faster progress and generating action plans for new solutions to address those challenges across a number of topics that will impact cancer prevention, diagnosis, treatment, and care. In some of the breakouts, you will be the expert on the topic. Others, you may be wondering what you're doing there, but you're there to bring a new perspective to that conversation. Now, I don't want to stand in the way of getting the rest of the program going, so I'm going to turn the floor back over to Carol Burnett. But I look forward to hearing the outcomes of some of these conversations in the wrap-up later today and the new ideas that move forward because of all of you. Thank you again for being here.
Thank you. Oh, I feel better up here. Thanks, Danielle. Our first speaker today is going to be Dr. Frida Lewis Hall, who comes to us from Pfizer in New York City, where she serves as Chief Medical Officer and Executive Vice President. Today, Dr. Lewis Hall will help set the stage for why today is an extraordinary time in research and medicine. Our next two speakers will speak about collaborations. Dr. Lynn Goldman is the Michael and Lori Dean of the Milken Institute School of Public Policy at George Washington University. Whew, it's a big one. Today, Dr. Goldman speaks on behalf of a partnership between George Washington and Case Western University. And our third speaker is going to be Kim Tibaldo, President and Chief Executive Officer at Cancer Support Community. Kim will speak about the recent launch of Frankly Speaking About Cancer Clinical Trials, a landmark cancer education series. So, without further ado, Dr. Frida Lewis Hall.
Good morning to all. No, maybe I do. I'm not nearly as tall as I thought I was. Somehow that proof point comes to me every day. First of all, let me thank Greg Simon for inviting me, to Vice President Biden for leading this incredible effort, to each and every one of you in this room and in rooms around the country for your commitment and determination that brought you here today, and to everyone that has worked feverishly to convene us. I've been asked to treat a broad thematic question this morning: why now? So that is the question, isn't it? Why now, as a nation, should we determine ourselves and commit ourselves to this audacious effort to end cancer as we know it? Why now, right now? But I'm not the only one that's going to ask that question today. Today, 1,500 Americans and their families will hear the dreaded words, "You have cancer." The young mother devoted to caring for her 2 young children will learn that she has lung cancer. Why now? The freshman in law school, ready to start his new life and new direction, diagnosed with leukemia. Why now? The farmer who's finally decided to lay down his plow and enjoy his golden years, to find those years threatened by a melanoma. Why now? These and so many more today, right now today, and tomorrow and the day after that and the day after that. Their lives, their life plans will be altered and in some cases ended. Their worlds turned upside down. Young children asked to care for their parents. Parents, like the Bidens and Carol Burnett, to face the unimaginable, the death of a child. The question is simply this: why now? And I think the answer is because now might be all we have. Why now on the science? What's different today than in 1971 when the National Cancer Act was signed and the war on cancer was first declared? Well, then we thought cancer was one thing. We've come to understand that it's hundreds of things. Then we were years away from mapping the human genome. Now we're building an army with that explosion of genetic information, of new precision medicines that are targeting cancers one by one, a cell at a time. We wondered then, what in the world is going on with our immune systems? Why has it failed us in this case? Now, an explosion of new immunotherapies. We've actually cracked the code on getting our immune system to kill, to fight on our behalf, and to defeat cancer. And a whole list of Star Wars technologies that we couldn't even have conceived of, not just 40 years ago, but in some cases 10 years ago, last year, or this morning, to hear about new surprising technologies that have advanced. Are we ready with the science? If not now, then when? And so we're learning to fight cancer at the cellular level. And if we think about it, it's an inward journey, right down to the cell. But to find out why now, I think we should ask an outward-facing question. Why now? Why now has this entire country escalated its fight against cancer at a personal level and a community level? Why now are we changing our behaviors? Don't smoke, stop smoking, learn the early warning signs, be diligent about screening, focus on prevention. All of these things we are doing every day at the personal level. We have pulled ourselves together in social media and created communities around this. We have taken our cellular fight out of the cell, out of the lab, onto the streets and into our own homes and communities. We as an American public are yearning for changes in this space. We're demanding them, and we're doing everything we can on social media, volunteering ourselves as citizen scientists. It is time, right now, at this exact moment, to meet this burning need. So we have the science, we have the urgent need, we have the social will. I'm going to dare say we have the political will, right here in this room and all around the country and around the world. We've raised our hand as Americans to say, okay, we'll lead this global effort now. We'll create the meta collaboration that's necessary, putting our personal desires and needs aside and focusing on the outcomes that we're after. We can do that. And we've shown that we have the capacity to do that before. We defeated polio, we turned the corner on HIV, and yes, no pun intended, we went to the moon and back. So we have everything that we need right now today. Now, is it going to be easy? No. You heard Vice President Biden say we have a number of challenges, things to be considered by this group and as many others as we can pull together in this fight. But we have everything we need for liftoff. When I graduated, from medical school, a newly minted physician, 36 years ago, was right across the quad there in Crampton Auditorium. I was living a personal professional dream to become a physician, to become a healer. And I consider myself very much a dreamer. But I couldn't imagine the progress that's been made in the last 36 years. And I can imagine that that progress is going to seem small and slow compared to what we're about to do starting right here, right now. So I would say to you, ask for yourselves the question that we know many will ask today, why now? And please answer. If the question is, why me? Why us? Who else but us? And if the question is, really, why now? Maybe it should be, why not now? Thank you.
Good morning. My name is Kim Thibaldeau, and I'm the CEO of the Cancer Support Community. I want to first thank Vice President Biden, Dr. Jill Biden, and the Moonshot team for their work in delivering this important summit today. I also want to thank you for including the Cancer Support Community. We are proud to be hosting 30 summits across the United States today at our Cancer Support Community centers, where we serve thousands of patients and their families. The Cancer Support Community is a nonprofit organization that specializes in all things related to the patient experience. Founded in 1982, the Cancer Support Community's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We deliver our free programs and services in 53 centers worldwide, online and by phone through our National Cancer Support Helpline. We serve people with all cancers at any stage of disease and their family members and loved ones. We at CSC embrace the goals set forth by Vice President Biden. In particular, we are fully committed to the goal of doubling the rate of progress in the fight against cancer. And we challenge everyone here today to ensure that patients and their caregivers are your most trusted and steadfast confidants and advisors throughout this process. I think we can agree that one of the most effective ways to advance innovation for patients is through participation in clinical trials. Yet today, only 3 to 4% of eligible cancer patients participate in a clinical trial. And patient misperceptions remain the same as they have since the 1970s. Concern about being used as a guinea pig and receiving a placebo, and concern about paying for your care out of pocket. Trials today are in medical language, they're in clinical language, they're in legal language. Trials are overwhelming, they're intimidating, and don't meet patients where they are. Misperceptions are negatively influencing patients' willingness to engage in the process. These misperceptions have to change if we are to see the kinds of advances that we all imagine. One of the themes of the Moonshot initiative is collaboration. Just last week, the Cancer Support Community launched Frankly Speaking About Cancer Clinical Trials, a comprehensive multimedia patient and caregiver education program designed by patients, for patients, to dispel the myths about clinical trials and to encourage patients to become active participants and partners in their care. This program was developed in collaboration with 20 organizations around the country, many of whom are here in the audience today, who have worked tirelessly with us over the past year to develop and launch this innovative initiative. Given what our research has shown, we felt it was important to take a fresh approach to this work. We began by talking with patients, hundreds of them from all across the US. We learned about their needs, their concerns, and the barriers that they face every day. We examined the emotional, personal, family, community, and cultural barriers to participation in clinical trials, and we are working with patients to find solutions. In fact, a lung cancer patient named Ide Mills, who is here today and who spoke at our launch last week, was on 2 different clinical trials, and she said at our program last week, I would go on a 3rd and a 4th and a 5th if I had to, because a clinical trial saved my life. The goals of the CSC Clinical Trials Education Program are simple. Number 1, increase the level of awareness of and participation in clinical trials, and number 2, move decision-making to the patient. We want patients to be educated and empowered to be smart and savvy decision makers. Frankly speaking, about cancer clinical trials provides a comprehensive set of resources powered by the full force of CSC's team of health professionals and our many partners to deliver exactly what patients told us they need. This includes seeing and hearing about clinical trials from real people in their own words and having information about trials available at their fingertips. And the program reflects the desire by patients to have more time with their healthcare providers to better understand their options. I have no doubt that this program will positively impact the patient experience with clinical trials, and we are proud to make this program available to our patients, to your patients, and to the Cancer Moonshot team. We are witnessing unprecedented advances in cancer care today, where big data has allowed and will continue to allow researchers and doctors and nurses to treat patients with cellular level specificity. Yet we know from the voices of patients that attitudes and beliefs, coupled with data, drive behaviors and decisions. So even in these most remarkable times, we must take the time to understand patients and to provide the support and tools to empower them to be informed and engaged participants in their own care. Anything less will fall short of the goals we all hope to achieve on behalf of patients. I want to close by sharing with you the unifying theme that emerged during our extensive work on this project, and it's a theme that we heard from Carol Burnett, it's a theme that we heard from the Vice President, and that theme is hope. Hope that an individual patient will have access to better treatment and better quality of life. Hope that future patients will benefit from those participating in trials today, and hope for a cure. Hope is at the very heart of what drove Vice President Biden to launch the Cancer Moonshot. There are those that may try to diminish what Moonshot can accomplish, but we at the cancer support community believe that hope, coupled with the commitment and expertise that surrounds this bold initiative, is at the core of innovation and promise for patients. Moonshot represents the best of what America can accomplish. So we look forward to working with you today and beyond to ensure that patients remain at the center of Cancer Moonshot, and that we indeed advance progress in both the medical and psychosocial aspects of the patient experience. Let's remember that patients are our true north in all that we do, and let's ensure that the patient voice is heard, and that the theme of hope drives our work today and well into the future. Thank you.
Good morning, and thanks so much to the Cancer Moonshot for the invitation to speak and to share our research. Especially I want to thank Greg Simon, who brought the Case Western University and the George Washington University Milken Institute School of Public Health together for our collaboration. Both of us had approached him separately with our ideas, and he recognized the potential for us to be able to work together to achieve a higher impact for our efforts, and we're very appreciative for that. So this work is about prevention. 40% of all of you in the room has or will be diagnosed with an invasive cancer at some point during your life, and 23% will die of cancer. We all want cures. We all want survivorship, healthy survivorship from cancer. We all want earlier detection of cancer, but most of all, none of us want to get cancer in the first place. When I'm talking about prevention, I'm really talking about primary prevention, stopping cancer before it starts. 30% of cancer deaths today are completely preventable if we apply what we already know about cancer causes and risks. In addition to that, we have new prevention science, new breakthroughs in behavioral science, epigenetics, and other omics that are helping us to understand how cancer develops in the first instance as a result of the behavior, our environment. and even vaccines and other interventions that have been developed to help to prevent cancer. We also have new opportunities for taking precision approaches to prevention. We can personalize our approaches to prevention in ways that we never could before because of behavioral science and better understanding of behavior, because of new marketing and communications tools that are being brought to bear in public health and prevention, because we're all carrying personalized devices with us that can be used to communicate and be used as tools to help in prevention, and because of social media that allows us to set up platforms to bring people together to support each other, people who would otherwise never meet, never have an opportunity to support each other. We've developed such a platform at George Washington University, the Text to Quit platform, that has been tailored to pregnant women, could be personalized to many other groups. These kinds of approaches are very important. So this collaboration between George Washington University and CASE that I mentioned, we're starting with two prime opportunities. One being smoking and the other one being the HPV vaccine, or we prefer to call it the cancer vaccine. Smoking, there's a federal target by the year 2020 to reduce smoking to 12%. However, unfortunately, here in Washington, D.C., while we've done very well with the white populations, only 7% now are smoking. In the African American population, the rates are 26%, an astounding disparity in risk. Likewise, in Cleveland, the rates of smoking are quite high, 35%. The HPV vaccine, the target is 80% coverage for those children who are between 13 and 15, that they would have received 3 doses of the vaccine. In DC, we've achieved 34%, not quite 80%, but better than Cleveland, which is at 12%. And in both cities, we have remarkable inequities also in the receipt of those vaccines. One might ask, tobacco, why would she be up here talking about tobacco? We already know how to do this. Aren't the rates of smoking going down? And certainly they are. However, tobacco is still the cause of 20% of cancer deaths. And the rates are the highest in low-income and minority communities like those right here in Washington, D.C. and in Cleveland. We can harness our connectivity to these communities and our collective capabilities to double down on smoking in these populations. HPV, the cancer vaccine. HPV disease is costing the economy between $6 and $7 billion a year, and it's responsible for nearly 5% of all cancers. We know that we can engage the parents, the schools, churches, policymakers, and healthcare providers who too often are not even offering the vaccine to assure that all children receive these immunizations. There would be enormous savings in healthcare as well as reduction in cancers. We're already seeing reductions in cancers from the incomplete use of this vaccine. At the core of our approach is the use of big data, linking to the electronic health records, both in DC and Cleveland, the local public health surveys, the behavioral risk factor surveys that public health conducts, but also data from the private sector, working with pharma and others that have data. But the engine behind that is largely behavioral science. It's behavioral science around marketing, around the use of social media, the use of devices, and also therapies like cognitive behavioral therapy. We have assembled an amazing team of scientists with expertise and deep experience in cancer prevention, smoking cessation, behavioral interventions, marketing, and HPV. And I wish I could have all of them on the stage with me today, but I do have Stan Gerson from CASE in the audience with me today. Thank you, Stan, for your collaboration and for the wonderful expertise that we're able to bring together. This work, primary prevention, can and must engage all of us. It has high impact. It has high yield. It's very cost effective. It is low risk. It is scalable nationally. Many thanks to Vice President Biden for getting us together. This Moonshot is giving us a first stage boost, but we know that we can get there. Thank you so much.